Okay, and then she goes on to ask about cycling for people who are doing a ketogenic diet. Is it a good idea to cycle in and out? And certainly for those, as we've talked about before, for those who are frail, for those who have low BMIs, for example, we want to make sure that you don't lose too much weight, and we want to make sure, again, support your network, and ketones good, but starvation bad. So cycling in and out is a good idea for those people. Don't lose too much weight. Now, as Julie has pointed out in the past, some do find that when they're out of ketosis, their cognition is not quite as good. They may have a little more brain fog or something like that. So again, as Anne has pointed out, you're cycling in and out during the day anyway. So you're doing some of that as it is. So, Anne, what do you recommend for your patients in terms of cycling out of ketosis?
Well, I absolutely do not want people to go below a minimum BMI.
Right.
If anyone's close to 18.5, I typically will have them cycle, meaning they're 2 days or 3 days trying their best to be in ketosis, a blood level of at least 1.5, or a breath level of at least 11. And then I have them cycle out of ketosis and do carb loading, things like sweet potatoes, cooked carrots, etc. Try to get the carbohydrates to be complex carbohydrates. Generally, that works well. Every 2 days to every 3 days, right? As often as they need to prevent weight loss. Now, I'm also going to be working with these people to try to improve their ability to digest and absorb fat. As I've talked about many times, some people need help digesting and absorbing fat. So this is a complex GI process in some people, but some people need hydrochloric acid, some people need pancreatic enzymes, some people need other kind of treatment to correct leaky gut so that their absorptive surface is healthy, because fats are the hardest to digest and the
Yeah.
hardest to absorb. If you're relying on fats for your calories and you can't digest them or you don't absorb them well, you're going to be in trouble, obviously, on a keto diet. So that's something that always needs to be in the picture and always needs to be worked on. But definitely, you don't want people to be in ketosis if their weight trajectory is rapidly downward to being underweight. Another thing that helps underweight people, I find, is really emphasizing strength training with them, building muscle. Muscle is going to use more calories, but it's also going to help them maintain their weight. And I recommend the blood flow restriction bands quite frequently, especially to my frail, little, very compact elderly people. They really need the strength training, no matter how little they can do at first, no matter how briefly they can do their strength exercises. They still need to do that every day.
Yeah, that's a really good point.